So one of the common questions we get would be, how do senior pets present with arthritis to the vets in a consult room? And typically, there's numerous ways they present. There may be a history of being lame, a little bit stiff. There may be a reluctance to move, and some people find their pets are just not getting out of bed. They may have decreased activity with the inability to move around. They may appear to be in pain or discomfort and, reluctant to move. Other times you'll get behavioural changes. They're just not doing what they used to do. So that's how they present to us. Then when they come into the consult room, the vets will obviously do a full physical exam. We may recommend certain treatments. We may recommend things like x-rays to diagnose certain things. It might be something we recommend sedating your pet to get a full exam or anaesthetising. So all those things are part of, getting the appropriate diagnosis for you to manage the condition that your pet's stiff with arthritis. What we then tend to find, we would tailor the treatment that would best suit your patient. And individual patients can vary in what they'll, tolerate or how they respond to medication. And when you come and have a consult with any of the Vets of Geelong, they'll go through, a little brochure that covers off what to do if you've got an arthritic dog. And it details, obviously, things here in the video, and obviously then details, different treatment options. And when we look at treatment options, it's going to come down to owner compliance, patient compliance, and the like. Some of the things we might start off with would be non-steroidal anti-inflammatory drugs. So they're generally a tablet or a liquid which is given on an as-per-needs basis, or they're given on a daily basis. Obviously, if your pet is problematic to give medication to, it may not be something you'll elect to choose to give. You've then got things like, gabapentin. So again, it's a different form of pain relief, acts differently to the non-steroidal anti-inflammatories, and some patients get a really good result. Side effects with that medication can be a little bit of sedation. We then get, some of the new modalities of treatment, such as Baranza, which is an injection, which is given once a month. And what we tend to find for those patients is it enables their joints to be less painful. They come in, have their injection, and they're generally up and at them fairly quickly. The other plus with this particular injection is you don't have to give daily medication. So for owners who, have a problematic pet to medicate, it's a really nice treatment. They come to the vet, nice, easy, and they don't have to do anything at home. There are also, other forms of injection called cartrophin injections or pentosan injections, and they're typically given at a different time interval, and they work differently to improve the synovial fluid in the joint and so forth. But again, some patients may be on combinations of these. We've then got opioid-based medication, and things that we can send patients home would be things like tramadol. And there are some, people out there who believe their pets respond really favourably with tramadol, and others less so. So it would be a tailored treatment based on the clinical response with your pet. Other less common treatments are things like ketamine injections, and that's an injection which we can give under the skin. And you tend to find some patients respond favourably with that as well. Works different to the other medications that I've talked about. And there's also these days we can use things like CBD oil, and again, side effects very different, bit of sedation, it's given daily and so forth. But these are all options to consider when we're reviewing holistically what we can do for your arthritic pet. So it's definitely warranted to come in, have a chat to the vet to go through what's appropriate for your pet. And particularly with those little senior dogs that come in, you might find they go on one or two medications, or we may chop and change based on other medical conditions. For example, if they had, kidney failure, there'd be certain medication we wouldn't give because it wouldn't help the other disease. So it's tailored treatment appropriate for your pet, and then hopefully we give your pet the best chance of moving around and keeping comfortable. But if you've got any questions about your senior dog and how we treat or manage arthritis, reach out to the team here at Vets of Geelong, and I'm sure they'll be more than happy to answer your questions.